Michelle Woolhouse is one of Australia's leading integrative GPs with 20 plus years experience using the proven therapeutic interventions of lifestyle medicine to improve symptoms such as weight gain, sleep, infertility, skin and hair problems. Dr. Woolhouse is the host of the Good Doctors and FX Medicine podcasts, which have attracted millions of downloads in Australia. Dr. Woolhouse also authored the popular mental health book, The Wonder Within. Michelle, you have a wealth of knowledge and experience in caring for people's health and helping them to improve it. And we can't possibly hope to cover the breadth of all of it today. So I just thought we'd dip into two of the issues that are perhaps seeing a rising incidence in Australia, and that is metabolic dysfunction and digestive disorders. And a very quick disclaimer here for the listeners, all that is discussed in today's podcasts is for general information only and should not be interpreted as individual medical advice. So Dr. Michelle Woolhouse, welcome to the Wellness Nurse podcast, where we seek to inspire and inform Australians about how to live longer and healthier lives.
Oh, lovely to be here, Ros. Thanks for inviting me.
Oh, thank you so much for your time. So, over your years as a GP, have you witnessed a change in some of the types of issues, perhaps, that your patients are presenting with, or the causes of their presenting symptoms?
Absolutely. I mean, I think it's vastly changed in the last 20 to 30 years. I mean, most people have some form of chronic disease from the age of 50. About 50% of people in Australia have at least one chronic disease by the age of 50, and that rises by the age of 65, with about 70% of people having at least one chronic disease by that age. And I guess what we've seen over the last 20 or 30 years is a really increased incidence of things like obesity, weight gain, even menopausal symptoms. Anxiety is certainly sky high. We know that in our children and youth, the rates of mental health are extraordinarily high now. So, we're seeing huge changes in metabolic health, in mental health, in physical health. And so I guess the question is, we're living longer, but are we living healthier lives? And so there's a new change in terminology between lifespan versus health span. And I think that, most GPs would attest to the fact that general practice has changed dramatically over that time and certainly has become kind of much more attuned to longer, need for longer consultations. It's like the bread and butter of general practice has definitely changed.
It's really interesting, and especially that you say that there is a need for longer consultations, but contrasting
They're getting
to that
shorter.
is that they are getting shorter. There's less and less time because there's more and more people that need that
well,
support.
It's more and more people, but it's more and more admin, burden, and the system is currently set up for an acute medical issues, and most of the medical issues that we have are chronic. So people, when they have an acute medical issue, they're having to wait a long period of time because they can't get an appointment. And then if they've got a chronic medical issue, they're not allocated enough time. So effectively, the system's not supporting the current state of health in Australia.
The real concern, because those issues are only increasing.
That's right.
Can you explain what metabolic health is and what are the key factors that can influence it?
Yeah, so metabolic health it's a really great terminology, metabolic health, because it really underpins a lot of what we call holistic sort of medicine. So what we used to kind of think about metabolism was either you had a fast or a slow metabolism, but now we know that metabolism is associated with pretty much every system within the body. And so a definition of metabolism is how we utilize and create energy within the body. And that has implications on how we absorb our energy, how we make and break down the energy, how we detoxify. Also has impacts on our immune system, our muscle and bone health, our inflammatory system, And so it's a really tight, nuanced system that is constantly on and constantly geared towards how our body functions. And so when we're out of balance with that, we can have all sorts of impacts in terms of our energy, our cognition, our brain health, and how all of the systems interplay. And that, of course, includes things like hormonal health, gut health, detoxification, as I mentioned before. So pretty much every system relies upon having a healthy metabolism.
And so those things that you're mentioning, cognition and energy, they're things that impact people on a day-to-day immediate basis, really. Are there any long-term impacts as well of metabolic
Of course.
dysfunction that people should be aware of?
Well, pretty much everything that we see in terms of chronic disease management is associated with metabolic dysfunction, from things like osteoporosis to osteoarthritis to chronic low-grade depression to even dementia. So they're now calling dementia type 3 diabetes. So type 2 diabetes is almost a ubiquitous kind of thing within the culture. 5 to 7% of Australians have type 2 diabetes, but even more, huge percentages have impaired glucose tolerance or pre-diabetes or metabolic syndrome. So they're different kind of variations of the same sort of theme, depending upon most likely your underlying genetics. And so long-term metabolic health has implications on lifespan, health span, aging, wound healing, mood, sleep, you name it. Long-term metabolic impacts have impacts, for pretty much every person. And in the US, they actually think only about 12% of the population have what they would consider a healthy metabolism. And particularly when you package up metabolic disorders into metabolic syndrome, pre-diabetes, type 2 diabetes, even depression, thyroid conditions, etc., you're looking at a vast number of the population have some impact on their metabolism. And then if you add things like stress and sleep in there, you've got all sorts of issues that's going on. So we've got about 44% of people that have got some form of sleep issue that impacts their daily lives. And that's a combination of sleep apnea, which affects about 11 to 13% of the population, and about 33% of the population have some form of chronic insomnia. So both of those things, it's hard to have sleep apnea and chronic insomnia at the same time. So they're kind of an additive scenario, which means about 44% of us have some sort of sleep disorder. And that has significant ramifications for metabolism because at night, when we sleep, there's a huge amount of energy required to actually stay asleep. We do huge amounts of detoxification and healing and inflammation balancing and cancer cell surveillance, all happens overnight. And the other thing that happens overnight is emotional clearing. So we think we process emotions through our dream state and through our memory state, and that helps us to lay down an understanding of the daily events and put them into a context that helps us to manage our affairs long term. So with that level of sleep issues, you have impacts on how a person functions both mentally and physically, and that has ramifications for metabolism as well. And so these are the kind of basic sort of 4 pillars that we need to really start focusing on as a society. And I think it's very missed in terms of going to a general practitioner appointment with something like a chronic disease, where the 4 pillars, which is diet, exercise, sleep, and stress, are really very rarely addressed in a modern day general practice environment. And what I mean by that is that our food supply has been drastically changing over the last 50, 60, 70 years. And so this rise of ultra-processed foods is just now ubiquitous within our culture. So, we feed, babies ultra-processed foods. We feed toddlers, little snacks that are ultra-processed foods. And they become a normal part of everybody's diet. The busier that we get, the more stressed people get, the poorer often their food choices. And unfortunately, doctors and GPs don't get offered very much in the way of nutritional training. And it's very time consuming to talk to somebody about their diet. And so we've kind of lost this connection between the understanding of what we put in our bodies and how we fuel our bodies equates to our metabolic health. Of course, when we see people that have got obesity or morbid obesity, we can see the connection. But of people with a normal weight, and even with people with mental health issues, we fail to recognize that there's a connection between how we feed our body and what nutrients the body has inside itself to be able to be required to operate at optimal levels. And then when you add stress onto that, what happens with stress is we actually utilize our nutrients so much faster. And so then whatever nutrients that we have, we're often losing them at higher rates. And that, further impacts the issue at hand. So yeah, we've got a lot of room for improvement, Ros.
It just sounds like it's compounding, really, because there's, you're saying 44% of maybe Australians or people in general are not getting the sleep they need because of insomnia or obstructive sleep apnea. The GPs, are seeing an increasing number of these situations, and yet there's maybe a gap in the training and the time that is available, during those consultations. It impacts just about every system within the body. What are we doing? How can we support people? We're all eating more processed foods in general. So this is such a common problem. What can we do using those pillars of lifestyle medicine? Where do we start?
Well, first of all is really just understanding the complexity and the simplicity of what we're really talking about. So
I love that.
Really looking at the basic tools within an individual's power is a really empowering way to start, and looking at education and making sure that people understand that all four of those pillars, stress, exercise, sleep, and food, really truly matter. And actually, for health practitioners across the board, be it practice nurses or GPs, really need to start emphasizing lifestyle medicine as the first stage of any disease intervention for any chronic disease, rather than thinking about medications first and then offering lifestyle medicine as a cursory aspect, And so because when people are inspired by these empowering things that they can do for their own health, it can really make a difference, particularly when delivered by practice nurses and GPs and health professionals. There is we know from research that our voice matters. It is taken as a trustworthy source, and that it can really be an aspect that can change people's behaviour in those early times. But I think that we can do more than that. I think as individuals and as a society and as groups of people, we can take this information on board and take it outside of the medical model. What I mean by that is this is our social medicine. This is our social health. This is how we connect with other people, and we can use food and healthy food as ways in which to connect. We really need to prioritize sleep and stress management as our key ways to care for ourselves, and also make sure that exercise and movement is built into our communities, into our lifestyles, into our weeks, and into our families. And it's something that we can do, but I think a little bit of education does go a long way. And one of the things that I've done at Vively, I'm a founding medical director of a tech company called Vively. And what we've done is we've used a lot of this information and education to really try and empower people to start earlier on their metabolic health journey, which means that rather than waiting until they've been diagnosed with type 2 diabetes, we want to really start the journey of proper prevention. So even starting in their 20s and 30s and 40s and 50s, it's never ever too late, but to really start to educate on those four pillars of health. And one way that we do that is by using a little machine. Well, it's not really a machine, but a little device called a CGM, which stands for continuous glucose monitoring. And by using something like continuous glucose monitoring, there's a lot of research that's coming out, even the last year or two, about the powerful influence this personalised data has in changing people's behaviour. So what a CGM does is it gives people an idea of their glucose levels in real time. And it works 24 hours a day, 7 days a week for 2 weeks. So you get 2 weeks of data. And it can really show you, what stress does to your glucose levels, what sleep does to your glucose levels, and what certain food choices and exercise do to your glucose levels. And what I found in my patients that use it is this ability to see inside themselves this really key metric, which is your glucose, and see how dynamic it is across the day based on your choices. But you can also see some of the negative choices, like going out for some fast food and maybe a soft drink, versus also seeing it when you make really good choices. And then it gives you this opportunity to have your cake and eat it too. So if you do make some bad choices, to go for a walk or a stroll after a heavy evening meal can make a major difference to both your glucose levels, but also your sleep levels as well. And so it gives people an idea of how they can see and witness and interpret an internal metric that is dynamic and changes with these 4 pillars of health.
It's very empowering to have that information to the individual in real time. You mentioned sleep and stress and how that can impact your glucose levels. Would you mind just touching on that just a little bit more?
Yeah, so whatever we eat, how we eat, whether we fast or not, or how stressed we are. So, for example, our stress mechanism has been evolved hundreds of thousands of years. So, thousands of years ago, the biggest threat to our health was predators, animals, maybe other people, maybe natural disasters and accidents, so trauma. And so that created a stress response inside of ourselves. And so a stress response is an acute response that the body has physiologically, and that makes us very active to try and change or make our situation more safe. And so the leading hormones that are involved with that is adrenaline and cortisol. So most people know what adrenaline is, we know what it feels like to be excited and also to feel anxious. But the other hormone that's involved is called cortisol. And that has a slower response, and it really activates the body to protect itself from trauma. So our blood gets sticky, our inflammation goes higher, we change our blood flow to various parts of the body, and we go on high alert. But the problem is most of us are pretty chronically stressed all the time. Now, this little chemical, cortisol, also has strong relationship with insulin, and insulin is strongly connected to glucose. So often when we push up our cortisol, we can either push up our glucose depending upon our insulin resistance levels, or we can push down our glucose too. So usually what we see is an acute rise in our blood sugars, and then we can see an acute drop. Both a huge rise in sugar and a drop in sugar is detrimental to the body. The body loves it when the sugars are nice and stable. And so that's how cortisol is connected, or stress is connected to glucose metabolism. Now, you also asked about sleep. So when we don't sleep well, or we only sleep for short periods of time, that actually increases the stress in the body. Because the body hasn't had that time to recover through the day and repair itself. So it's kind of coming into a new day, all its pieces not lined up. And so when we don't sleep well, our hormones are often very regulatory over the evening time. And so if that doesn't happen, we then get chronic hormonal dysfunction, and that can therefore lead to changes in homeostasis and other levels of balance the body loves. So that's why they're all important to interact. And often what happens with patient education is we tend to bang on about one thing, fitness or food, or we don't really talk about sleep very much, or stress, but it's the whole package that is really required, and they all positively influence one another. And so that's a really powerful thing that people should understand, so that they can feel really, because if you change your diet and you don't start feeling any better, but you're still not sleeping well, you've got to kind of look at those 4 pillars at the same time.
Makes a lot of sense. So it's really, it's a foundation. They're all interconnected. And if one is out of whack, then really the whole picture is still out of whack.
That's
Even
right.
though people may be losing weight or, they may be increasing the amount of exercise. If their sleep is still rubbish, then there's
Yeah,
still
that's
work
right.
to be done.
That's right. If you're not
Yeah.
sleeping well and you're exercising a lot, sometimes that can add stress to the body. And that is, for lots of people, that can actually limit the amount of weight loss. If you're trying to lose weight, that can impact the weight management that you're after, because the stress then hasn't been addressed, and that can impact weight gain too.
Mm. Mm. I'm wondering if we could shift the conversation a little bit and talk about another problem that's on the rise, and that is digestive disorders. Can you talk us through what's going on in that space?
Well, it's not really that surprising, is it? I mean, when we introduce ultra high processed foods to our diet that are often high in sugar, they're often really high in salt, and they can also be high in quite a lot of food chemicals. So things like colors, artificial flavors, perhaps things like MSG and emulsifiers, those kind of things. They have all got roles to play in impacting negatively the gut biome, and also what they call the metabolome, so how the gut biome produces the metabolites and the impact that those metabolites have on overall health as well. And so it's really important to understand, it's like the worse food that we put into our systems, or the more processed that they are, the more unlike our natural needs. We have these natural needs. And so often ultra high processed foods are devoid of fiber as well. And so fiber is essentially the building blocks, or the food, for our gut bacteria. And so if we don't feed our gut bacteria, we don't produce the good metabolites, which we don't absorb. And then we start the whole vicious cycle as well. The other really interesting issue that's happened since the 1950s is the introduction of antibiotics. So, and what we know is when babies are given antibiotics in that first year of life, and even out to the first 2 years of life, that has a significant impact on their gut biome. The other impact that we see is that Caesar rates are going up significantly higher. So again, let's say back in the 1950s, most babies were born per vagina. Now, most babies are born, or many, many babies are born, through cesarean section. And so the babies don't start off through the vaginal canal, which is their first dose of gut bacteria that they get from mother's biome. And so all of these things really matter. And we also have a ubiquitous kind of use of antibiotics in pregnant women, particularly if they have a strep positive swab of their vagina, and that's to prevent meningitis in little babies. And so we're also seeing that we're giving women at the time of birth a lot of antibiotics, and that just has an impact on the gut biome overall. And then when you add things like stress and high sugar diets and poor nutrition, etc., we're starting to get a recipe for how we start off life with poorer gut bacteria and poorer gut diversity. And the other thing that they think is having a huge impact is our obsession with cleanliness too. So we do know that kids that grow up in the country with lots of animals and pets and, digging in the dirt, etc., have better gut biomes than kids that are in the city, in more sterile environments, particularly environments that might be particularly clean. And some people love to keep environments particularly clean, and that can have an impact as well. And we know that when the biome is not as diverse, there's an increased risk of allergies. And as we know, talking about what we've seen change over the last 30 or so years is the amount of allergies that are around. And peanut allergies, which used to be rare when I went to school, is now pretty much there's one in every classroom.
So our modern day lifestyles have changed our gut completely, really.
Completely.
So
we don't even know what a great gut biome looks like, put it that way. And we think we do. There's apparently a woman in Canada that they use she's never had a dose of antibiotics. I think she grew up in a rural sort of environment with a mother who was very meticulous about nutrition. So there's a 30-year-old Canadian woman who apparently has a fairly close, beautiful
One woman.
gut biome.
Excellent.
But look,
Yeah.
I mean, the point is that it's such new information that we really don't know what a optimal gut biome looks like. We know that diversity matters. Everybody has a unique imprint of their gut biome, which is really amazing. All of us have got a unique fingerprint. We also have a unique gut biome link, which also increases our diversity as humans as well. So we get our genetic material from our mum and dad, but we also get so much of our genetic material from our gut bacteria as well. And so, even though you share 50% of your DNA with your siblings or your parent or your child, you can have a vastly different gut biome as well from your relatives. And that can make a big difference of where you were born or what you were doing at the time of your birth, and first couple of years of life really matter.
So one thing we could immediately do is reduce the amount of processed foods that we're eating.
100%.
What
Best
else
way to start.
can we do? What can we introduce into our diet to develop our gut microbiome?
So really focusing on fiber is really important. So fiber and diverse fiber is really great. So I mean, you can't really go wrong with vegetables, particularly above ground vegetables, lots of green leafy vegetables and nuts and seeds and berries and herbs and those kind of things as well. So I often suggest to patients, to really seek out their local farmers market. Even variations of food really matter. So, there's a couple of different types of kale. So get a different bunch every week. There's different types of broccoli. There's different colours of cauliflowers. There's different colours of sweet potatoes. So in carrots, diversity really matters and the colours really matter. So that can be a really fun way of starting to introduce those things into people's diets as well. And herbs are really easy as well. A, they're really easy to grow. And B, there's lots of them and they're highly, highly flavoursome. So they can add lots of fibre, lots of flavour and lots of phytonutrients, which can be a great thing to introduce. So for people starting out, reducing down your ultra-processed foods, reducing down your sugar and increasing your vegetable fibers, nuts and seeds and berries, great way to start.
That's terrific practical hands-on information that I think people can take with them. It's easier said than done for some people. I'm thinking of students in particular, and they're sort of looking at the, how much the fruit and veggies are costing and whatnot. I think farmers markets are really helpful, and if you find a good one, you can get reasonably priced fruit and vegetables. I think that's
the other
good.
thing for people on a budget to realise is that frozen vegetables and frozen fruits are as nutritious as their fresh counterparts. I mean, there's probably some other aspects of energetics that's not so ideal. However, when you're on a budget, it is something to think about. To get frozen berries, you almost get 4 punnets for the same price as 1.5 punnets in the frozen varieties. So yeah, they can be a good way and a simple way, particularly for people on a budget.
That's excellent. That's a really great tip. Yeah, thank you. I think our listeners will have a much better understanding of metabolic health from this discussion. Is there anything else that you'd like to add that would encourage listeners to seek help if they need to?
Yeah, I would recommend seeking help early and really know your numbers as well. I think that, when you feel well, so there's metrics such as things like fatigue, brain fog, you're looking for vitality, you're looking for, your mood to be as stable and as vital as you can, your concentration to be good too. They're really early signs that things are less than ideal. And that's a way in which, you really want to seek that lifestyle medicine. So really you should be feeling vitally well, most of the time. The other people to engage with, perhaps just as an idea, are people like nutritionists, naturopaths, exercise physiologists, those kind of people that are on the part of those 4 pillars. and maybe even a psychologist if you're stressed, or a social worker, those kind of people, or even talking to a practice nurse about these things for to really understand your relationship to food, really understand your relationship to exercise, and understand how these 4 pillars work is a great pathway. I think try and be as proactive. I'm going to give a tip to non-practitioners listening, is that doctors, nurses, health professionals, allies, they all love passionate people that want to do stuff for prevention. That's what I find.
Yes.
And so if you're keen on prevention, you can go to any practitioner and they'll be really excited to meet you halfway and help you be the best that you can be.
That's so true. I think there are so many practitioners that can support people on their journey, and sometimes people only need to engage those services for a short, maybe an intense period of time, just to get them going really on that journey. I know I engaged a health coach for a few months, and it basically turned my life on a different trajectory. And I'm so grateful. And I think if people can identify, one of the things I'm hoping to do in my business, I'm launching hopefully soon in a month or so, is to provide a screening test that we can look at these metrics. And, if people take those steps and then proactively seek out the experts that can help them on those pillars of health, their life really is just so full of hope, and it can change so much. Yeah, I'd really encourage people to do that as well.
Yeah,
Yes.
health coaching's a great opportunity. We didn't even have it sort of 10 years ago
No,
or
that's
so.
right.
So,
Yeah.
yeah.
Yes. Oh, Michelle, thank you so much for your time today. It's just been such an honour to speak with
My pleasure.
you, and I'm so grateful. And I'm
No
sure the
worries, Ros.
listeners have just learned so much today. Thank you.
Thanks, Ros. And just for your listeners, if they want to have a look at Vively, it is www.vively.com.au. So it's a great little program that they can explore and have a look at, and take that to their health practitioner for even more deep dive information into their metabolic health.
Terrific. Thank you so much.
No worries. Thanks, Ros. Have a great day.
You too.